Hello everyone, welcome to our webinar, How Optometry Businesses Are Managing COVID-19 Recovery on Social Media, featuring Hootsuite. Today's webinar is brought to you by Premier Academy 360, designed to attract and retain patients and increase revenues. Premier Academy 360 offers effective and actionable education that's credible, simple, and results-driven, and provided to you at no charge. They have workshops, webinars, resource libraries, and e-learnings. Visit learnacademy360.com to learn more. So for anyone new with us today, I'd like to quickly share who and what my marketing team are. We are a benefit for VSP Global Premier Program Practices and provide you a dedicated team of marketing professionals. We are here to help you reach, connect, and engage with current and potential patients. We craft monthly newsletters, marketing materials, promotions, and tips to keep you up to date with social media trends. We share content, tips, and tools to help you and your practice save time. We create fresh and engaging marketing materials to share with your patients. We offer monthly educational marketing webinars, much like today. And during this time, we have pivoted our regular efforts to provide additional support for the COVID-19 crisis. I am so excited to welcome our awesome speakers today. We have Erin and Ashley from Hootsuite, and they are absolute experts in the social media space. So take it away, ladies.
Amazing. Thank you so much. And I'm just going to jump into the content because I'm so excited to share all of this with you. Now, let me start off by reminding everybody that very few of us have experienced a global pandemic in our lifetime, and certainly not within recent times have we seen an event of this magnitude affect the entire global community, right? And I find sometimes that's hard to recall because it seems like this has been going on forever. But this graph is just comparing some of the conversation volumes globally to other key stories from January 2016 to 2020. And that's including the Hong Kong protests, Brexit, mentions of Trump. As you can see, COVID-19 is dwarfing them all. And that is that pink line that you see going straight up. Before I get into how COVID has really affected your customer journey, I thought I'd remind you of what the pre-COVID path to purchase was like. And it was already pretty digitally heavy, right? And this is a fantastic exercise for you guys to run through on your own, is to really map that customer journey. And that can consider all of the awareness and decision-making steps that customers follow when they're engaging with your organizations, as well as the processes and channels that they will encounter while they're on this path to purchase. And the reality is that there are tens of customer journeys that you can consider as your own customer needs change, from considering how a child and their first pair of glasses is sold to, someone looking into contacts for a teenager, maybe getting treatment for eye-related conditions. The options are numerous. But this is a generic path to purchase that was conceptualized by the Review of Optometry Business. And they identified 5 stages in that customer journey, from researching treatment or product options to researching providers, at which case you're now really evaluating and comparing the treatment options that are available out there. Then you're going to be considering the financial ramifications of this purchase. And then finally, you're going to actually make that purchase, right? So now I found this study particularly interesting. The Review of Optometry Business wanted to outline the path to purchase for the patient. And so they conducted a survey in late 2018, I believe, and had like around 2,700 respondents who made or plans to make optometry or optical purchases. And the survey revealed several decision factors that I would love to highlight. Firstly, it is driven by need, right? Optometry or optical purchases are often seen as a necessity. The second thing I want to point out is that it's a relatively straightforward process. A purchase decision takes roughly 56 days, involves 5 to 6 stages. 66% of respondents always say that they've researched healthcare providers online before selecting a provider. So the internet is key here. Consumers generally begin with an internet search, and they tend to consider many factors. Cost is a concern for these buyers. Affordability is important. In fact, over a third of respondents say that they have declined an optometry or optical purchase due to cost. And this is going to be even more important as we talk about how COVID-19 has affected the disposable income for many households. Lastly, consumers might be unaware of financing, but they are open to it. So that might be an option for a content pillar for you guys. Is how can you educate your audience about the options that are available to them? So now that we've established that the pre-COVID path to purchase for optometry products has been dependent on digital media for some time, I thought I'd share one of the observations that I've been making during this pandemic. And it's that social media is so much more of a means or than just a means of disseminating information. It's an extension of relationship building. It's a means of reaching, communicating, and building trust with communities for both people and brands, right? And we're seeing Facebook reporting a 70% monthly increase in video calling, over 100% on month-on-month growth in WhatsApp and video calls, and over 44% more time spent on social media for most internet users. So that's pretty substantial. So how has this increase in social media consumption affected the way that people speak about the resumption of normalcy and the reopening of the economy? If we're to look at how people speak about optometrists and the reopening of eye clinics in particular, the conversation really gained traction around May. Earlier, I mentioned that the review of optometry business and the survey that they conducted found that patients really deem optometry clinics as a necessity. So see this peak in early May before the entire country had even gotten to phase one is not entirely shocking. People were just eager to get back into things that they think were necessary. Now, it's important to note that much of this reopening the economy conversation is wrought with emotion. And this is a pie chart that's displaying exactly what that looked like for people who are mentioning the reopening of their eye doctor as of June 26th. And people were expressing disgust towards the struggles of lockdown. They were expressing fear of a second wave, and that's probably the most prevalent emotion that we saw. Joy in relation to the resumption of some semblance of normalcy. And I do want to point out that it is possible that this pie chart will look very different in the coming weeks, even as fear continues to rise. And so the role of the optometry business's content should be to alleviate some of those fears. And I'm going to pass it on to Erin, who is your point of contact here at Hootsuite, your resident social media guru, who's going to tell you how some businesses have been approaching this issue.
Thank you, Ashley. Before I jump into best practices, I thought I'd examine some amazing stories for how optometry brands have been assuaging the fears of their audience. Eyes on Sunrise is one practice that chose to highlight the safety precautions they're taking in their practice. If you're looking for an optometrist, posts like this are important. It shows the people at Eyes on Sunrise care about their patients and their community. Claren Eyewear is another brand taking this approach. They produced a video that spoke to COVID-19 reopening expectations, surface and product hygiene, and other precautionary measures their stores are undertaking to ensure customers and employees are kept safe. Eyediology Vision Care shares their behind-the-scenes stories on Instagram, where they showcase the changes in their in-office experience, which included enhanced pre-appointment and history screenings, masks for doctors, associates, and patients, temperature screenings for everyone, COVID-specific disinfecting and hygiene protocols, and even appointments designed to reinforce social distancing. So what else have we been seeing that we would consider best in class? Well, we put together 5 best practices for communicating on social media during reopening. First step is to use storytelling to showcase offline experience. People are more forgiving of imperfect content right now because we know that businesses don't have all the time in the world to dedicate to social media. Unpolished stories are fine. They humanize your brand, and they make it easier for the average person to put themselves as the protagonist of that story. Meaning they can easily see themselves going through the motions of requesting an appointment, social distancing while waiting for the doctor, choosing frames, and things along those lines. Next, information, accuracy, and clarity. A recent study found that 55% of Americans are getting their news from social media. Now more than ever, it is important to make sure that you are publishing the correct information with credible sources. Keep your audience abreast of changes as they occur. If you need talking points or to refer your audience to an expert, do so. Whether it is the CDC or state-run website, if you don't have all the answers, that is completely to be expected. Third step is to use media that respects social distancing. This one's pretty self-explanatory. Be mindful of new norms and new views on proprietary and public spaces. Number 4, train staff on how to respond to incoming messages. Hootsuite saw an increase of 415 private messages sent between brands and customers during the COVID months. It's important to create a consistent set of frequently asked questions and answers. Number 5, consider how to handle complaints. Respond quickly and acknowledge mistakes. It's also great to put together an escalation plan and remain empathetic and compassionate with them. Brookside Optometry highlights their curbside pickup option available to patients during the pandemic. Now, the reason I'm calling this out is because what we mentioned at the beginning of this presentation when we said that most patients are unaware of their options as it relates to eye care. This is a great idea for a content pillar so that your audience can achieve a further understanding of their options. So that's it from our perspective. In terms of how you should be leveraging social to reopen your business and keep those communication channels open with your audience. We thought we'd leave you with just a quick recap from our Communicating in COVID webinar, because the points are still relevant from earlier this year. Number 1, rapid and direct communication. If there are any disruptions to system operations and business as usual, let your audience know on social very quickly. Support for people who need help or information. Think about the composition of your social audience and where you can add the most value to vulnerable subgroups. And thirdly, use social listening to understand what's happening in the world, in your industry, and what people need from your brand.
We appreciate your time today and hope you've learned more about marketing during COVID-19 that you can easily share with your patients in the office or through your social media. Some quick housekeeping before we say goodbye. You can visit our website to find the My Marketing Team COVID-19 Resource Kit. Stay in the know by following our VSP provider's Facebook page and Twitter account. And lastly, if you're looking for a great social media resource, visit our website to request a Hootsuite account. Thank you so much for your time today, and we would love to hear your thoughts on today's webinar. You can email us at mymarketingteam@vspglobal.com.